That's a great question. So, if you have a child who got a vaccine recently and then they had some kind of reaction or adverse event, how do you prove that it was actually the vaccine? Because sometimes you're told there's no proof of that. So, how do you determine what was the cause, whether it was the vaccine or something else? So, it's a really good question and comment. And as a pediatrician, this is generally how I approach it. I'm not sure about the CDC if there's specific protocols. There might be. Fortunately, I haven't had any major adverse reactions or events with any of my patients over the years, so I haven't had to deal with that. But I've seen minor reactions happen, things like fever, rash, and the general thought process I approach when a reaction happens to determine if it's a vaccine or something else is timeline. So most vaccines, if you're going to have a reaction to it, it happens within the first 48 to 72 hours of getting that vaccine. Some exceptions to this are the live ones like MMR varicella, which will cause a reaction about a week after you get the shot. But generally, there's specific timelines after a shot that you can expect to see a reaction. If a child has a reaction or adverse event within that timeline, then we can confidently say it was probably the vaccine. But if they have a reaction outside of that expected timeline for a reaction, then we think it could be something else and probably not the vaccine. A good example would be if a child gets DTaP and they get a fever a day after. Well, I'm pretty confident it was the DTaP, but if they get a fever like a month after or a week after the DTaP, well, then I know that probably wasn't the case. The other thing is the length of symptoms. Most vaccine reactions don't last more than a day or two. So if a child has a fever for 5 days, I'm not thinking that's the vaccine. I'm thinking they got something else more serious, and I'm testing them for infections and other things. And that's also important. If you think there's another cause, you can test to rule out other causes. If a child comes in with fever 3 days after they get a shot, and they come back, positive for flu or COVID on a nasal swab, then I'm thinking it's the flu or COVID or virus that they got causing that fever and not the vaccine. And I can use a test like a nasal swab to confirm that. So generally, that's how I approach it. I look, does the adverse reaction or the side effect fit in the timeline for the vaccine that the child got, that they would get a reaction in this time frame, or is it outside of the expected time frame for a reaction? And the other part is that, are there any other potential causes that I can rule out with testing or assessing them to attribute that reaction to if it's not the vaccine? And sometimes, we're scratching our head a bit. We don't know totally for sure, if it was the vaccine or something else. And that's where I think transparency is important. I think a doctor should be able to say, listen, I don't think it was the vaccine, but it's still possible, but here's some other things, and just laying it out there for the parent so that they fully understand what's going on, and then they can make an informed decision moving forward.